So hi there, I am Sruveera Sathi or Dr. Sathi. I went to the College of William and Mary where I studied neuroscience and public health and then took some gap years, did a master's program at Georgetown University. Before then, matriculating into medical school at Georgetown University School of Medicine. After that, I went to residency in psychiatry at UT Southwestern in Dallas, Texas, and am currently a child and adolescent psychiatry fellow back at Georgetown University. I was selected to be a Monroe Scholar, which is a scholarship given to individuals who are in the top 7% of the incoming class at College of William and Mary. I was also awarded a grant to conduct research at William and Mary. And then in my master's program at Georgetown, I was awarded the most outstanding capstone paper in physiology. And then in medical school, I was awarded scholarships all 4 years, and then a summer research grant allowed me to do research work on surgical disparities in endocrine surgery, and have also been able to publish research in various specialties as I was exploring, which have included surgery, as I mentioned, dermatology, as well as psychiatry. And then in residency, I was chosen and completed the clinician educator track. Also in medical school, I was awarded Gold Humanism Honor Society. Being organized, planning ahead, whether it's for exams or on your rotations. I would also say your personality really matters, especially in the clinical rotations where you'll not only be interacting with patients, but also ancillary staff, attendings, families. So being genuinely interested, being coachable, being likable, and taking initiative to help the whole team out and with patient care. One, I would say, is my experience and my personalized touch with consulting. So with regards to experience, I've consulted for admissions groups over the past few years in a formal sense and have been able to work with hundreds of students, been able to review their applications, coach them in interviews, edit their essays, and have seen what works and what doesn't. And so I just have a sheer number of data points to work off of. I have also assisted with admissions at my medical school, conducting mock interviews, also in residency, conducting group interviews and assisting in recruitment efforts. And then my individualized touch, I really take the time to get to know individuals, what their goals and motivations are, and help their strengths truly shine, and also identify areas in line with their strengths that they can enhance even more, as well as being honest and empathetic with delivering what can be improved. So as a fellow physician, I've gone through all these steps. So I've gone through gap years, medical school, matching at my first choice residency in a very competitive area with no ties, and then now in fellowship. So I've gone through multiple stages and feel like that, along with my experiences, would provide a great asset to students. I will also say my schedule is fairly flexible in fellowship compared to a lot of other specialties, which would allow me to, give individualized attention and, quick responses to students when they need help. And then given my background in psychiatry, I will say I'm also very attuned to how this can be a very stressful and at times very emotionally taxing process. So my training prepares me to be in tune with what a student has gone through and is going through, and pay attention to that and keep that in mind while I am advising them. Simply, it's what I would have wanted as a first-gen pre-med and now med student and physician myself. A lot of advice that I got was, often fragmented in different places, not as personalized, sometimes not as compassionate as I would have liked. So I aim to, be the guide that I would have wanted when I was going through this. Thank you so much.